Good evening and welcome to our COVID-19 update. I am Ladi Akiridoluale. Here are the updates at this hour. Southeast state of Anambra records first COVID-19 fatality. Governor blames interstate travel and late presentation. States in the southwest and southeast identify increased testing and breach of interstate travel ban for increase in number of COVID-19 cases. And U.S. confirmed cases crossed the 1.7 million mark as New York Stock Exchange reopens its trading floor after a 2-month closure. We start tonight from Anambra State in the southeastern part of Nigeria, where the first death from COVID-19 has been recorded, just as 3 patients were discharged from the state's isolation center, including its index case. Governor Willie Obiano announced this while giving an update on the fight against the coronavirus in the state. The patient who died was said to have reported late to a private medical facility. To give us more about this, we're being joined by the governor of Anambra State, Chief Willie Obiano, who joins us via Skype from Oka in Anambra State. Good evening, Your Excellency. Thank you for your time.
Good evening.
You are quoted as having said that interstate travel ban, the breach of this interstate travel ban has been one of the major challenges that you've had to face. Yet, over the weekend, you attempted to solve that problem. First, our condolences on the loss that the state suffered of this fatality. But how have you been coping with this other challenge which you have identified?
Well, that's actually a major problem. When we started, we were concentrating on 5 boundary links. We eventually discovered that we had 22, and we had to equip men and women, even political appointees, to take over those borders. That has helped immensely. I'm sure you are aware we put a gate at MIC border and the gate by the bridgehead. And today we had a good discussion with Delta State on manning their own end of the bridge. And there was a very useful discussion that will reduce the traffic on the bridge so that going forward, only people that do essential services, medical personnel will be allowed to cross the bridge. I want to reassure you that the curfew is being obeyed very strictly at the borders, and I think that curfew has done a long way to help us in helping this pandemic.
One of the problems that your state has faced, given the interstate travel ban, we're still staying with that, is the seeming influx of the Almajiri youth who have been displaced in some parts of the north, some of them sneaking through the land borders into states in the southeast. What have you been able to do about this as part of the general plan to contain COVID-19 and its possible spread?
Well, we've been stopping and turning back youths. I'm not sure they are majories, because they are fully blooded people and men and women, and very smart people, very strong, that are coming from the north to Anambra and other places in the southeast, but with the efforts ourselves in the governors of the southeast in helping to, put a barrier in our borders, that will go a long way in helping to stop this. But I want to reassure you that on 6 occasions we've been able to intercept very big lorries carrying youths and from various parts of Nigeria coming into Anambra State, and we've turned them back and escorted them back to where they came from.
A couple of days ago, you inaugurated 2 water schemes that together were to serve about 17 communities, if my memory serves me correctly. And this was also part of the efforts at helping combat COVID-19, providing running water in some of those communities. What other plans in this regard do you have to make it possible for people to take care of themselves, look after themselves, as opposed to waiting until there are confirmed cases and then now having to use government's health facilities?
Well, those 2 major water projects that I recently commissioned were done with the assistance of EU in partnership with Anambra State government. The Otuocha water scheme will serve about 5 communities in that area, clean, drinkable pipe-borne water. Then the Obizi water scheme will serve 48 communities. In the first phase, they are serving 17 as we speak, and more reticulation is being done to cover the whole of Aguata area, one of the largest areas and landmass and population in Anambra State. Secondly, as you must have been, as you would have observed, we've been fumigating markets where butchers, shops, and what have you. The largest cattle market in Anambra State is in Amansi. That's a red flag for us, and we're also fumigating that place. We commenced that work there on Friday. Not only that, we've emphasized Operation Deba Anambra. That means keep Anambra clean. People are cleaning the environment. People are becoming more conscious of hygiene and what have you. Part of protocol procedure, part of a COVID procedure is to wash your hands regularly, use hand sanitizers, social distancing, wearing of face masks. Those are being enforced. I must tell you, it's not easy. Most people will wear their face mask and hold it on the neck until they see an enforcement agent, then they'll put it across their nose. So with education, pressure, arrest, mobile courts, and what have you, I believe in some way will help to put some consciousness on the people that they must learn to respect this illness. But let me tell you my view on this thing. This disease called COVID-19 has come to stay. So as far as we are concerned, it's going to be like malaria. And the earlier we begin to adjust our daily lives, respect what this illness likes, that is to wear face masks, social distance, wash your hands regularly and what have you, and go about our normal business, because you can't lock down people forever. They must look for their daily bread, and I believe that strongly. I'm one of the fellows that strongly support non-lockdown of activities. But in the interim, until such a time that the federal government directs, all borders remain locked and locked properly. The gates we put on Niger Bridge, they are temporary. But by the way, in the mornings we open the gates after people have been processed in the buffer zone at Asaba end. So it's not like the gate is permanently locked. No, but at night, yes, at night from 8 p.m. to 6 a.m. it is permanently locked, and the law enforcement agents have ensured that. And same, I can assure you, is with all our borders. Thank you.
Your Excellency, let me finally ask you, Anambra is known for markets, and you've spoken quite a great deal about markets. But recently there had been talk that you'd been under tremendous pressure and that you, in fact, to some extent, succumbed to that pressure to allow both the markets and particularly places of religious worship to open in direct contrast to some of your colleagues and in direct contrast to the NCDC protocol. Could you explain what was the thinking behind that?
It's very simple. Most of my people are hand-to-mouth people. They go to market and you can't lock them down. I've distributed palliatives to the age 75 and above, a bag of rice each, some tomatoes and what have you. I've also done so for all the youths in the 179 communities, you know, and the truth is that I can't sustain that, you know, so I need to allow these people to go and fend for themselves, more so obeying COVID protocols. And by the way, before the biggest market in West Africa is in Anambra State. And that market, I locked it down for 5 solid weeks, 5 weeks. And before they were allowed to reopen all the 63 markets, they brought representatives, which are the COVID member teams, you know, that we trained for 1 week on protocols to be observed in the market. I want to say that they're observing that about 70%. You know, and we have threatened any market that has not or that is not obeying that, because we send some people and I get daily reports that we are going to shut them down. You know, so they are sitting up. You know, but I am confident that that is the right decision. COVID, I beg your pardon. The non-COVID challenges will kill more people than COVID. If you lock people in there, you lock so many things in. You know, you lock hunger, you know, and a hungry man is an angry man. You know, these people have to fend for themselves. I didn't get any support from anybody, you know, to support my people. In the Anambra as a whole, we are the people and myself fending for our people here, you know, and we can't continue to fend for them indefinitely, you know, because we don't have the resources. So I had no option than to allow them to go there. And like I told you, I'm of the school of thought that this COVID is come to stay. So locking people down will not solve problem. It will kill more people. I can assure you that. And you look at it very soon, you begin to find out that that is correct. You can't lock people down. Locking them down will cause hunger. Hunger will kill more people. Other diseases will kill more people. I wish we are tabulating the deaths of COVID line by line with the deaths in malaria, Lassa fever, in hepatitis, or in all kinds of things. I wish we were tabulating those deaths like that. You would have seen that COVID is a small issue around here.
Thank you very much, Your Excellency, the Governor of Anambra State, Chief Willie Obiano. Thank you so much for your time. We do wish you the best of luck with this COVID-19 pandemic. Thank you very much.
Thank you very much for having me. Thank you.
Staying in the southeast, but moving on to Imo State, where the government there has also been speaking tough on interstate travel through the state. The task force chairman on COVID-19 in that state, Professor Maurice Iwu, explains that the recent positive cases were traced to interstate travelers and could have been avoided. Our correspondent, Tope Kute, has the details.
According to the NCDC, Imo State has 26 new cases of the coronavirus disease. However, the state government has been speaking on these new cases and their present status. Addressing journalists earlier today, the chairman of the COVID-19 task force in Imo State, Professor Maurice Iwu, said while traveling through Imo State, 96 persons were intercepted at the border by security operatives while enforcing the interstate travel ban. And out of 96 samples taken, 26 came out positive.
Security did intercept some buses carrying about 96 people into our state. And as routinely as we do, they took samples from them. And then they allowed them to continue where they were going because there were 96 of them. And then when the results came back, we found that 25 out of that 96, these 96 people are people we classify as silent spreader because they didn't know that they were carrying it, and they passed on. And it was good that we took their samples and tested them. And we have since notified the places they were going to because they were not actually bound to, they are not coming to Imo State, they were passing through. And we stopped everybody that passed through the state, and they took samples from them. It's still necessary to stress that our guideline of not allowing people to come into the state based on the federal regulation that interstate movements for now are prohibited.
The state government says stiffer measures will be put in place to checkmate and prevent interstate travel, even as the 6 p.m. to 6 a.m. dusk to dawn curfew is still in place across the 27 local government areas of the state to contain the spread of the coronavirus in Imo State. From Owerri, the Imo State capital, Eyitope Kuteyi for COVID-19 update.
Thank you very much, Eyitope. Moving on to Abuja, where the COVID-19 pandemic has put added pressure on maternal and child care. Though there is still no proof that pregnant women can transfer the disease to their unborn children, the World Health Organization has expressed concern over the additional burden on COVID-19, especially on maternal and child care, especially in poor communities. Our next report looks at the status of maternal and child care in Nigeria in the era of COVID-19.
Mother-to-child transmission of COVID-19 has not been proven yet. However, it's a fact that pregnant women can be badly affected by respiratory infections, hence the need for extra precaution against the virus. The World Health Organization recommends that pregnant women with symptoms of COVID-19 be prioritized for testing and given special care if they test positive.
For women with severe disease of COVID-19, we require oxygenation. For instance, if their blood pressure is too low, they could be placed on intravenous fluids. They can also receive the oral or intravenous treatments that we offer for patients with coronavirus. Once a woman delivers and she's COVID-19 positive, she's allowed to breastfeed her baby while maintaining hand hygiene, respiratory hygiene. She wears her face masks. Pregnant women with COVID-19 can have vaginal delivery because there is no established evidence that the virus is transmitted by the vaginal route.
So far, 4 babies have been born to COVID-19 patients in the Lagos State University Teaching Hospital. Childcare is already a challenge in Nigeria before COVID-19. The situation is much worse during this pandemic.
During the lockdown, are people really aware that immunization services are continuing? Some are not really aware. They thought, okay, since there's a lockdown, means that immunization services have been relegated to the background. So where you are now having children missing vaccinations, where you cannot do all those supplemental vaccination activities that you are doing, it means that an outbreak may be imminent. You have intracity lockdown, you have intercity lockdown, you have flight cancellation, you have trade deals cancellation. So that may affect maybe the supply of those essential drugs, inflow into the country. We, Nigerians, want to hoard those few available drugs.
The World Health Organization is currently calling on experts, especially from poor countries, to serve on a strategic and technical advisory group on maternal, newborn, child, adolescent health and nutrition. Before COVID-19, 2.8 million pregnant women and newborns die every year from preventable causes. More needs to be done, especially in terms of prevention, to ensure the burden from COVID-19 does not make the situation worse.
Okay, so there you have that. Thank you very much, Kayla Megwa from our Abuja studios. Joining me here in the studio is Dr. Alera Roberts, consultant public health physician and senior lecturer, maternal and child health, College of Medicine, University of Lagos. Thank you, Doc, for coming in.
Thank you for having me again.
And under more pleasant circumstances this time than the last time.
Definitely.
Pregnant women are especially vulnerable.
Actually, not especially vulnerable, not more vulnerable than any other person in the community. So far,
Let me put you on pause, Doc. We need to take a break. We'll come back after the break, and I'll find out from Dr. Roberts why pregnant women are not particularly at risk. Thank you for staying tuned. Welcome back to our COVID-19 update. Before the break, I was talking to Dr. Alera Roberts, and she's still here. And I'm going to try to find out, as I said before the break, Why are pregnant women not particularly susceptible? I ask this against the background that we encourage them to go for weekly antenatal care because they are in a particularly delicate state. And then, of course, given this situation, the affairs of mother-child transmission and so on. And so why do you say they're not particularly...
No, what I mean by that is that this is a new virus. It's hitting what we call an immunologically naive population. So everybody has an equal opportunity of being infected by this virus. So that they're not more or less susceptible than any other person in the community. And coincidentally, I heard the cameraman asking, even the children under 10, everybody has an equal opportunity to be infected with this virus. Everybody has an equal opportunity to manifest disease, although we know that some people are manifesting the disease to a greater or lesser extent than others. And we know the age demographic, the comorbidities, the people who have got poor immune systems, and so on and so forth. So pregnant women have the same opportunity as any other person in the community to contract the disease. And yes, we are encouraging pregnant women to continue going for their antenatal clinics. However, we have to accept that they have a real fear of going into a health facility. And so we've kind of had to come up with all kinds of innovative strategies at community level to ensure that the pregnant women are still going to get the care that they need. So you'll find that, a lot of midwives, and I must pay my homage to all midwives in the community who are working really, really hard to keep their pregnant women and the women who have just delivered safe. We salute you. What they've done is in some areas, in very innovative areas, they've set up a WhatsApp group with the women that they are handling, who can then, through that group, they can ask questions, they can get their concerns and anxieties dealt with, and if the midwife feels the need, she can escalate it up to the doctor she's speaking with and advise the woman at the material point in time to go to the health facility. Now, this only works because the midwives have been able to engender that level of trust with the women they're looking after. So because the women trust them and trust their advice, they can then escalate the care up. But to all intents and purposes, yes, the pregnant woman has just as much, is just as much at risk as anybody else in the community.
That then brings up the question that I kind of added to the last one, which has to do with the possibility of mother-to-child transmission.
The data isn't all in yet, so there have been instances where, babies have been born and are tested and are positive. Now, whether that transmission occurs in utero when the baby is still in the womb, whether it occurs as the baby is transiting through the birth canal, or whether it occurs shortly after birth, we really don't know yet. But we do know that there have been a couple of cases. I think there was a case of a baby that died in the UK who had contracted it from a member of staff who was corona positive. So whether there's actual mother-to-child transmission, and if it is not yet as understood as we have understood, say, with HIV, where we know the percentage of babies that get infected either in utero, through the birth canal, after birth, or through breastfeeding. That data we will not have until we've studied this virus a little longer.
What would you tell a pregnant woman who's watching this right now and who doesn't know her status as of yet, doesn't know whether she's COVID positive or negative, and may want to find out and may want to also keep her baby safe? What are the things that she could basically do?
I would seriously suggest you get your midwife on speed dial on your phone and establish a relationship with your care provider so that you can chat with him or her, if it's a midwife, it's a her, about your fears, your concerns, and she can then advise as to when you need to come in. What we do tend to is, because we can sort of do a lot more remote consultations, we don't need to bring a woman in at a crowded period in the clinic.
Right.
That's, so we can maintain the physical distance between pregnant women by saying they come in maybe 2 or 3 at a time and they can sit, a distance apart and everything. And of course, the midwives are properly trained and protected to care for them. But please, get your midwife on speed dial on your phone right now and make sure you develop a relationship with her in the community.
I'll put you on a second pause, Doc. We want to go to Bauchi now, where our correspondent Hajara Aliu has another side, shall we say, of this issue with pregnant women.
These children are out to celebrate, but the timing is wrong. COVID-19 is a reality and it spares no one. Children are a handful and someone has to be responsible for their safety.
Public health experts have identified 3 places where the safety of the child must be ensured: at home, outside the home, and in school when they resume.
As much as possible also, parents should not just allow their children to be going out randomly, play football and so on and so forth, because you never can tell what kind of children they are going to interact with.
The home being the best place to start. In addition to other precautionary measures, parents are advised to educate the children about the current situation. Be alert, step up personal and environmental hygiene, and when school resumes, demand that only healthy teachers be allowed to teach children. Omobola Farayola is heavy with her second child. What she's gone through to access antenatal care during the pandemic is not encouraging, but she manages to push through.
I'm close to my due date, but due to the fear of COVID-19, I was told that if there's any complaint, I should call my nurse or my consultant on phone. I should not bother coming to the clinic, which is not supposed to be.
There are positive stories of less than 1-year-old babies that have recovered from the virus. Pregnant women are also suffering the heat. One infected expectant mother in Imo State has gone in and out of false labor, owing to increased anxiety caused by the coronavirus.
We are managing her like any other patient, and up to now we don't have a confirmed research showing that there is a vertical transmission from the mother to the child. You recall there was a lady too who put to bed recently in some state. So there is no any confirmed whether COVID-19 is going to be transmitted vertically from the mother to the fetus or during breastfeeding.
All precautionary measures of keeping safe also apply to children and pregnant mothers. But for this vulnerable group, extra care must be taken. Hajara Aliyu for COVID-19 update.
Thank you very much, Hajara. Dr. Roberts, what do you make of that?
Well, these are the sad realities that we're seeing, because don't forget, we're still second to only one other country in the world in terms of the indices for maternal mortality. So it's still a very dicey time for mothers, pregnant women, and being able to keep them safe is paramount. And part of keeping them safe, of course, means addressing their anxieties and concerns. So far, you can see that what Imo State is doing is pretty much
what you said.
Yeah, par for the course in terms of what we said. But, I think for me, one of the saddest things about this is watching all those lovely children playing in the sun, and the fact that now we're having to keep them apart from one another. They're not able to go to school. But it's important that parents and carers teach the children the importance of hand washing, sanitation, keeping a physical distance, and reporting any illness. Because at the end of the day, that's our future. The children will be infected, but will not manifest the disease to the severity that adults will. But they can then pass it backwards to other vulnerables in their homes. And these are the things that we need to take care of.
Now, if we're going to take a look at it, there are a lot of people who believe that anytime when you talk about children and so on, children, nothing's going to happen to children. Their immunity is 100%. They haven't been sullied by anything, and they will get over it even if they were to contract it. Is that a medical fact?
So far, that is what we are seeing. But we're also seeing a very disturbing multi-system inflammation syndrome in children. It's been reported in the UK, reported in the Lancet, reported in the US. I do not know if we have seen any in Nigeria yet, whether we've seen it and it simply hasn't been reported, we don't know. But since there is a risk, we do have to apply an overabundance of caution where children are concerned. So merely dismissing it out of hand will not be a very wise thing to do. I think that we still need to be cautious. I would, and make sure children are properly looked after, brought up in as sanitary a condition as possible, and make sure they're safe if and when they do return to school.
So all the protocols that have been established for their parents will also apply
to them. Must apply to them at the same time. It's going to be very challenging in the education sector, I know, because children need to be taught, and children being taught learn better with touch. We do know that touch plays a very important part in the neurodevelopment of children. However, how we manage this really depends on how we develop the herd immunity and how we flatten the curve to make sure that if a child does get ill, whether from COVID or some other COVID-related syndrome, there is space in the health system to make sure that child gets the very best care.
As always, plenty of food for thought and plenty of meat to chew away. Dr. Roberts, thank you so much for coming in.
Thank you for
Dr.
having
Alera
me.
Roberts, consultant public health physician. She's also a senior lecturer in maternal and child health at the College of Medicine in the University of Lagos. A pleasure to have you as always.
Thank you.
The Oyo State government says it is mindful of the increasing number of positive cases as the state now takes 6th position on the national COVID-19 recorded cases table. The state, however, insists that community testing is the solution to curbing the increase in the number. Let's get more information from our correspondent, Bukola Oriowo.
Oyo State has moved from its 14th position just in the space of 1 week to 6th in the COVID-19 statistical data nationally, which means that in the last 1 week there's been a lot of activities, especially for people testing positive in the state. And I think this necessitated the fact that community testing is rife right now. And so the state is about embarking on community testing this week, before this week runs to an end, or at most by the weekend. And to do this, they have designated 10 different areas where this will be taking place across the 33 local government areas of the state. It's going to be operated like a mobile clinic of sort to allow more people to get tested, to actually go to them in their community, in their areas, to get this test done for them. So we went around town to find out how much awareness do people have about it, and then how much trust do they have in the system.
People who have subjected themselves for the testing, they later found out that they are not really infected, perhaps because of the faulty test kits which tested them positive.
We need it because this thing is affecting everybody, and if the government can do the community testing, or what is it called, so that everybody is tested, so we can start the normal day-to-day activities.
Out of 2,232 suspected cases, Oyo State has confirmed 244, and they're about commencing community testing. More awareness, apparently, is needed to gain the trust of the people and let them realize the need and the urgency for this test to be carried out. For COVID-19 update, Bukola Oriowo.
Thank you very much, Bukola. I'm being joined in the studios now by Professor Oluwarotimi Akinola. He's a professor of obstetrics and gynecology. He's also the national president of the Society of Gynecology and Obstetrics of Nigeria. Thank you so much for coming in. Thank you for your time.
Thanks for having me.
Pregnant women in particular, I'm sure you listened to Dr. Roberts, are not particularly at risk any more than the rest of the population at this point in time. But given what has happened in recent past, would you say that we need to make special provisions for them, given your own experience with dealing with them?
Certainly, yes. One, because it's an at-risk group. From every other thing that we knew about most illnesses, we knew that immunity is depressed somehow in pregnancy. So, whilst you say, for example, because this is a new disease, we do not know. We don't know whether pregnant women are more prone to it or whether the outcome is worse in them or it's not, because it's a new disease. So one cannot be categorical, but certainly, because we're dealing with a different circumstance, we're dealing with a mother, a child, and that kind of strange situation where it's neither one or two, but a mixture somewhere. So that's where, and then there are already problems in pregnancy
that are unrelated
to COVID. And then there are also sociological implications of this, which might impact negatively, particularly in, we are the capital, world capital for maternal mortality now. And so anything that makes that worse, actually this is coming at a very bad time for us.
Given that, what would you say that now needs to be done to make that provision? Because in the general commotion that COVID-19 has caused, it seems as if some people have gotten either left behind or gotten ignored. This group we're talking about is one. Many of them have not been able to go to the hospitals for usual antenatal care because they have been told, well, that could put you at risk of exposure and all of that. So those who can are doing some kind of social media,
remote
clinics
and all that. Yes, truly, our society came out pretty early at the onset of this late March with an advisory to practitioners, which I think is NCDC also, FIGO, World Health Organization sanctioned. And that's the fact that you reduce the number of visits that these women have, so that it reduces the exposure. If you go to most of our antenatal clinics, you see the grouping and all the large crowd and all that sort of thing, that this is not the time for that. So we advocate that perhaps you see them less frequently, or at occasions when it will be more impactful, so that you can, what we call focused antenatal care. So it's not as business as usual, but you go in for specific things. So we give wider appointments, longer appointments, and see them less frequently. We think that still subsists because hospitals are not, most diseases will go to the hospital. So the risk of contracting infection usually will be maximal when you go to the hospital.
The other thing that is there is to take a look at this question of mother-child, possibilities of transmission. This is your field of expertise. This is what you do. You deal with this on a daily basis. When other ailments like this have surfaced, when we had HIV. When we had that, this was one of the big issues that came out of that, the possibility of mother-child transmission. I asked Dr. Roberts this, but I'm also going to ask you. Given the fact that there is the possibility of this transmission, even though we don't have the exact numbers because we're still looking at this, what do you think that can be done now for those who are listening to you that they can use possibly to guard themselves against the possibility that if they were to be positive, they could prevent themselves from passing this on? Or is that a tall task?
Well, on the contrary, most guidelines state, for example, that yes, unlike most of those other diseases where we had the problem of transplacental, that is vertical transmission, like HIV and all that to the baby, it's only one instance that's been proven that they found antibodies in the baby. IgM, they are big, they cannot pass through the placenta. So when the child is born and they found the antibody, it meant that the baby must have been exposed to the virus and that produced antibody in utero. So that case had been published and documented. Several other cases, smaller ones and other sort of things, have shown that there is no such thing. But right now, particularly in the developing low, middle-income countries and all that, children tend to die more from gastrointestinal problems, diarrheas, and all those
things. The things
that
had been on
ground before. So what we still advocate is that these children still be breastfed. Masking. Mothers should wear masks while breastfeeding their children. And all that. It's presumed that the baby had not been vertically infected and should not be infected now horizontally. So those are the things, the measures that are being taken. But like I said, it's a developing thing. There's no treatment. And so you cannot say, for example, like in HIV, if you use antiretroviral drugs, transmission to the baby is minimized. That doesn't exist. So it's physical barrier that you can use to prevent this happening.
For someone in your practice now, is it possible for you to actually, at the point of delivery now, because, I mean, at the end of all the lovely care, the baby still has to be delivered. How much of a risk is there now when patients such as those present themselves?
Again, interestingly, we don't have that data, that pool of data. In Nigeria, perhaps now, because you deal with what's been, maybe in Lagos, we've had about 4 or 5 kids delivered to COVID positive women. But what we've heard from the US and from the other places and all that is the fact that delivery, again, our advisory is that don't interfere with the delivery process, allow it to go. But where obstetrics dictates that they must have surgery, they have surgery, sections are performed, whatever is necessary should be done. But then every patient is taken as if they were COVID positive.
Okay.
So that universal precautions must go in. You limit the number of people who are present at delivery. You limit the number of people who are present at resuscitating the child. And then if you need to do any procedure, you do it with maximal care and protection. And even in where it is proven that the patient, you know, like in the United States now, you might get into labor ward and they say before you're taken in for an induction of labor, they must get your COVID status done.
Yes, that's right.
We aren't there yet. I mean, if you take 48 hours here, or sometimes like 1 week or 10 days to get your results, the patient's either well or the patient has long departed before you get your results. So you just got to treat everybody with universal precaution. And so those are the limitations that we have. But everything should be done as appropriate, and women with all those complications will arise, whether or not they have COVID. The only thing that's been found out is the fact, for example, that we're having a little more prematurity, perhaps because of the fever that's involved, so that triggers labor, so it could increase the risk of premature delivery. And if that happens, of course, it also complications of prematurity to the infant and all that. So those are the things that are documented as at now.
Professor of Obstetrics and Gynecology, Oluwarotimi Akinola, National President, Society of Gynecology and Obstetrics of Nigeria. It's been a pleasure having you with us. Thank you so much for your thoughts.
Thank you very much for having me.
We'll take a break. When we come back, we'll update you on where we stand with confirmed cases, recoveries, and deaths with COVID-19 in Nigeria. Plus, outside our shores, what's the situation? Please stay on with us. Thanks for staying tuned. Welcome back. Nigeria recorded 299 new cases of COVID-19 in 14 states and the Federal Capital Territory, bringing the total number of infections in the country to 8,068. According to the NCDC, the Nigeria Center for Disease Control, a total of 2,311 patients have been discharged from various isolation centers across the country, and sadly, 233 deaths have been recorded. Lagos is leading in the southwest of Nigeria with 3,595 cases, followed by Kano in the northwest by 919. The FCT in the North Central region maintains the third highest tally with 519 cases, while Borno still leads in the northeast with 255, Edo in the south-south with 191, and Ebonyi and Imo now lead in the southeast, having an equal number of 33 cases each. Governor Andrew Cuomo today rang the start of trading at the New York Stock Exchange after a 2-month closure. The exchange, which opened under new measures, one of which is that only a quarter of the nominal number of traders will be allowed to return to work. Traders must also avoid public transport, wear masks, and follow strict social distancing rules with newly fitted transparent barriers to keep people apart. A global pledging campaign has raised more than $10.4 billion for the development of vaccines and therapies against COVID-19. All this also comes as the figures of confirmed cases in the United States were 1,716,000. 1,000. Take responsibility in protecting your health. The NCDC website has all the information and statistics on the cases across states, with regular updates on COVID-19 regulations and several guidelines as to how to efficiently self-isolate and what it means to social distance. From the World Health Organization, physical distancing is one of the most effective methods to limit the spread of COVID-19. Stay at home when possible and maintain at least 1 meter distance between you and others. The website has rolling updates on the pandemic, the World Health Body's strategies and plans on the coronavirus, and each moment it keeps updating on the number of cases, the number of deaths, and the recovery efforts across board. You can also take a look at some of the numbers in real time. Our website, channelstv.com, has the latest news. All you need to do is log on and access the news in health, politics, business, sports, Africa, and around the world at your fingertips, especially, of course, the latest on the COVID-19 pandemic. Thank you for your time. That's our COVID-19 update. I am Ladi Akiri Doluale. Good night.